Hello everyone, I am Dr. Sonal Kumta and I am the Senior Obstetrician and Gynecologist practicing at the Fortis Hospital Mulund. Today I am going to give you some information about white discharge. Now, as we all know, there could be a physiological discharge or it could be an infective or a pathological discharge. What is a physiological discharge? Physiological means the normal natural discharge that you are supposed to have during different parts of the menstrual cycle. And a pathological discharge is usually as a result of infection. So, how do you know when it's a physiological discharge and when is a pathological discharge? Because when you have an infection or a pathological discharge, it's best you come and meet the gynecologist. So, some women experience a whitish discharge which is similar to egg white at around ovulation time, that could be in the middle part of their cycle. Now this is a physiological discharge and this discharge is not accompanied by any kind of itching and also it is never colored. It is white transparent discharge. Some girls may experience excessive discharge just a little before their menstruation starts also. So this can also be a physiological discharge, and usually unless this discharge is too much in quantity, that is unless it is not copious, we don't recommend any kind of treatment for this discharge. I would just tell my patients that if you are bothered by excessive discharge, maybe you can change your inners more frequently or you can use something as simple as a panty liner and change it frequently. As opposed to that, a pathological or an infective discharge will usually have some excessive itching or burning sensation in the private parts. It might have a very bad or a foul odor, and it's usually a colored discharge. Meaning what? It could be white curdy discharge which looks like small pieces of paneer or curd. It could be a yellowish discharge. It could be a greenish discharge, or sometimes it could be a pinkish, reddish or brownish discharge also. Please remember that this discharge usually suggests some kind of infection. It is best if you can go to the gynecologist, let her examine you and then give you the right treatment for the pathological discharge. Because unless we take a look, unless we see, it is very difficult to know what kind of infection it is and treat it. Sometimes we also like to take a swab from the vagina or cervix and send this for culture and testing so that we can treat you better. So this is very important for you to note that if it's a physiological discharge, maybe it doesn't require any treatment, but if it is an infective or a pathological discharge, you must see the gynecologist. As a last word, sometimes excessive discharge can also, or a excessive blood stained brownish pinkish discharge can also be an early sign or symptom of the cervical or uterine cancers. So it's always better to go for a checkup and let the doctor tell you what they feel is best for your discharge. Thank you.